Hello, everyone, and thank you for joining this webinar on the expenditure reporting form for the opioid settlements and bankruptcy. My name is Chelsea Kelleher, and I work for Aurora Health Group, and we will be helping the Department of Healthcare Services facilitate today's webinar. Next slide, please. Just a couple of housekeeping items before we begin. If you have a technical question or you're experiencing any technical difficulties today, please send a direct message to Audrey Richardson from Aurora Health Group, and she'll be glad to help you out. The meeting materials today will be available following the webinar on the DHCS OSF webpage. Those materials should be available either later today or early tomorrow, so you will have access to all of the slides and information that's presented today. The webinar will provide an opportunity for questions. Please use the Q&A feature on your Zoom control panel to ask your questions, and we'll be pausing at various points throughout the presentation to review those questions with the DHCS team. DHCS will be focusing on questions that are applicable to all cities and counties. So if you have questions that pertain to your specific plan for spending requirements, or spending settlement funds, we would recommend contacting DHCS either through completing a TA form on the settlements webpage or emailing at osf@dhcs.ca.gov. Any questions that we don't cover today will be compiled for a Q&A document, which will be posted to the website. And additionally, DHCS will be planning and sending out information about office hours over the next few months. So you will have the opportunity, once you have the form, to be able to have office hours sessions with the DHCS team for your questions. Next slide, please. I wanted to just highlight a few of the past webinars and listening sessions that have been held for the opioid settlement so far. So DHCS has provided several informational webinars over the past year and a half, which we would encourage you to review. They provide information about how to allocate settlement funds, how to work with your local opioid coalitions, and allowable uses of funds. They are available on the DHCS OSF webpage as well as linked here. Please do keep in mind that webinars that pertain to reporting, specifically from last year, will be superseded by guidance that's provided in this webinar. So please refer to the most updated information available about reporting requirements. Next slide, please. So today during the webinar, DHCS will be providing an update on California's opioid settlement and bankruptcy agreements. DHCS will be reviewing the updated expenditure reporting form with a focus on elements that have changed or been updated for this reporting year. And then finally, we will have opportunity for Q&A with the participants. Next slide, please. So with that, I will turn it over to our DHCS team leads, Nancy Kitzmiller and Heather Gardner. They will walk us through an overview of the settlements and the new reporting requirements. Nancy and Heather are unit chiefs in the substance use disorder section of DHCS, which is tasked with overseeing the use and reporting of settlement funds among cities and counties. So I'll turn it to you, Nancy and Heather.
Hello, everyone. I'm Heather Gardner, Monitoring Unit 2 Chief. So to start off our meeting today, we will start off with the status of the opioid settlements. Since our last reporting session, there have been several updates on the opioid settlements and bankruptcy. Settlements with Teva, Allergan, CVS, Walmart, Walgreens, and Kroger are considered final, and payments are forthcoming. Payments received from these settlements will not be included in this reporting period. Additional settlements with Hipma and Amneal are also pending and will not be included in this reporting form. The state will continue to update cities and counties on the status of these settlements. In 2023, Mallinckrodt Pharmaceuticals filed a second bankruptcy due to difficulties in providing payments during the state fiscal year 22-23. This second bankruptcy established another payment for participating entities. The second payment from NOAT II will be included in this reporting period for state fiscal year 23-24. This slide provides an overview of the payment structure of the settlements. Note that the settlement payment structure has not changed, and pending settlements previously discussed are anticipated to follow this same structure. A quick reminder on the allocation and uses here. The California Abatement Accounts Fund must be used for future opioid remediation activities, like those described in Exhibit E. In addition, at least half of the California Abatement Accounts Fund must be spent on high-impact abatement activities, which can be found in the relative California state subdivision agreements, as well as on the DHCS opioid settlement webpage. The California Subdivision Fund can be used toward future and past opioid-related expenses, such as litigation fees. This fund is only allocated to those cities and counties that were initial plaintiff subdivisions. If a city or county does not spend money on litigation, if the city or county does spend money on litigation, it must be reported to Brown-Greer. Please note that Brown-Greer refers to these expenses as non-opioid remediation uses. DHCS refers to these expenses as past opioid-related activities. Finally, the California State Fund is used by the state for future opioid remediation. Statewide activities are determined by the state legislature. We'd also like to provide Can you go back one slide? Thank you. We'd also like to provide a reminder on the NOAT2 payment structure. The payment structure for the second payment from the Mallinckrodt bankruptcy is the same as the first payment from NOAT2. Specifically, the majority of funds were distributed directly to cities and counties. The local government share must be used for future opioid remediation listed in Exhibit 4 of the Mallinckrodt bankruptcy plan. This is the same as Exhibit E in the National Opioid Settlement Agreements. Monies dispersed to the state through the NOAT2 state share may be used for opioid remediation. Uses for those funds are also determined by the state legislature. DHCS will continue to be the oversight entity for city and county governments as they receive funds from the settlements in bankruptcy. The responsibilities of this oversight include monitoring the California cities and counties for compliance with the abatement accounts, designating additional high-impact abatement activities with the abatement accounts, conducting related stakeholder engagement, and preparing annual reports. Those reports will include abatement accounts, subdivision fund, and NOAT2 funds. As a general reminder, DHCS does not make payments to city and county governments. All settlement payments come from Brown-Greer and bankruptcy payments come from NOAT2. Any questions regarding allegations or payments should be directed to those entities. In addition to the status updates, we would also like to remind folks about the reporting requirements for the settlements in bankruptcy. City and county governments receiving funds from the opioid settlements and Mallinckrodt bankruptcy are required to complete annual reporting to DHCS. This includes any funds that are rolled over or encumbered from year to year. Like in the first reporting period, DHCS will review submitted reports and prepare an annual written report regarding state, city, and county government use of funds. This process will continue each year until all funds are fully expended and for 1 year thereafter. DHCS is currently working on the public report for the state fiscal year 22-23 and will produce a similar report for state fiscal year 23-24. In collaboration with UCLA's Integrated Substance Abuse Programs, we have updated the expenditure reporting form. The reporting form for fiscal year 23-24 will open on July 1st and close on September 30th, 2024. While there was an automatic extension applied last year during the first year of reporting, there will be no automatic extension during this reporting period. You'll see that the reporting form is now opened immediately after the end of the fiscal year per request by cities and counties. This allows cities and counties over 90 days to complete reporting. I'll now turn the time over to Nancy Kitzmiller.
So opioid settlement expenditure reporting form. In addition to the change in the reporting period, there are several details we would like to note for cities and counties before we walk through the state fiscal year 23-24 form. First, in this reporting cycle, city and county governments will be asked to report on payments and expenditures during the 23-24 fiscal year, which ran from July 1st, 2023 through June 30th, 2024. Payments that are covered in the reporting cycle include year 3 payments from both Janssen and distributors and second payment from Mallinckrodt Pharmaceuticals. Note that some participating subdivisions may have received prepayments from Janssen and distributors in fiscal year 23-24. This is a year 7 payment. Please ensure any prepayments received during that state fiscal year 23-24 are included in your total payment amount reported. Prepayments received after this time, that is after June 30th, will be included in next year's reporting cycle. Overview of the changes. After the first reporting period, DHCS analyzed common questions, challenges, and other difficulties experienced by cities and counties with the initial reporting forms. This feedback was used to improve the reporting form to reduce challenges for staff completing the form. We've highlighted a few of the challenges and updates here. First, having 2 reporting forms for cities and counties to complete for the settlements and bankruptcy was a challenge. The updated reporting form includes both settlements and bankruptcy reporting. Next, the past reporting form was unclear on what timeframe should be included in the expenditure reporting. In this updated version, we've added information to indicate the timeframe for state fiscal year. We also heard that the old reporting form was confusing on how to report encumbered funds. In the updated form, we've added areas to indicate encumbered funds for the California Abatement Accounts Fund. Please note, DHCS would recommend that California subdivision funds are spent in a timely manner, like the California Abatement Accounts Fund. Finally, the past reporting form was unclear on what information city and county governments should report to DHCS versus Brown-Greer on past opioid-related expenses. We've updated this to include sections that clarify reporting on past opioid-related expenses. We've also included information on reporting to Brown-Greer. Form structure. With these updates, the state fiscal year 23-24 expenditure reporting form will contain the following structure. First, cities and counties will indicate which opioid agreements they've joined. Cities and counties will then include contact information for the individual completing the form. Where applicable, cities and counties will be asked about their payments and expenditures from the California Abatement Accounts Fund, California Subdivision Fund, and Mallinckrodt Bankruptcy. The form will end with an attestation section where the preparer will sign and submit the form on behalf of their city or county. As a reminder, any contact information provided during the reporting should be business related. No personal contact information should be provided. Individual city and county reports will be published along with the state's annual report on the DHCS opioid settlement webpage. Submission requirements. Similarly to last year, only one person should prepare and submit the expenditure reporting form on behalf of their city or county. The preparer does not have to complete the reporting form all at once. The survey can be returned to if the same browser is used and if cookies and history have not been deleted from the browser. We encourage cities and counties to have the data saved elsewhere prior to entering their information in the form, in case there are any technical glitches with saving. A PDF version of the form will be provided so that your cities and counties can collect all data before entering it into the online form. Please note that all reporting must be completed online. Support documents. In addition to this presentation, there are additional support documents available to cities and counties. It's recommended to review the PDF preview and collect all data before starting the online reporting form. The necessary materials can serve as a guide for the information you need before starting the form. The question and answer Q&A document has questions DHCS has received regarding the form and answers that we have provided. Exhibit E outlines allowable opioid remediation activities. And finally, a list of payments to participating subdivisions can also be found on the DHCS OSF webpage. I'll turn it back over to Heather here.
Thanks, Nancy. We will now walk through a preview of the online expenditure reporting form. Section 1 asks that you select whether your city or county received funds from the opioid settlements or bankruptcy, or both. Selections here will ensure your city and county completes only the required sections based on your allocations. Section 2 collects basic information about your city and county government and the individual completing the online form. Again, please only provide your professional contact information. Personal, non-business contact information should not be included. We have added fields for additional contact information so the DHCS can easily contact cities and counties with any questions. Section 3 will cover which specific settlement your city or county has received. Selections here will ensure your city and county completes only the required sections based on your settlement allocations. Nancy will now continue.
California Abatement Accounts Fund. Sections 1 through 3 complete the initial section of the form. Section 4 will cover any payments received from the California Abatement Account Fund. Note that participating subdivisions may have received 2 payments in the year. Section 5 will cover interest earned on funds from the California Abatement Accounts Fund. Only interest accrued in the fiscal year 23-24 should be reported. Please do not include any interest that was previously reported. Section 6 will cover any reallocation of funds between cities and counties. Reallocations do not include fund redistribution to a county by Brown-Greer due to a city opting out of direct payment. For state fiscal year 23-24, we have updated this section to include an indication of which fiscal year reallocated funds were initially dispersed by Brown-Greer. The year of initial disbursement from Brown-Greer will be used to calculate periods of expenditure for spending of the reallocated funds. As a reminder, funds will need to be spent within 5 years of the initial disbursement or 7 years for capital outlay projects. Section 7 will ask cities and counties to provide a breakdown of direct and indirect costs for a specific activity, as well as any funds encumbered for said activity during the fiscal year. For additional information on allowable indirect costs, please see the DHCS Administrative Cost Policy. This section will also include fields for cities and counties to indicate any funds encumbered for this activity in the previous fiscal year, which would have been 22-23. Section 7 will also ask cities and counties to categorize their expenditures by Exhibit E allowable expenses. Please review Exhibit E in advance to determine which category best fits your reported activity. We adjusted this section of the form as well so that cities and counties will only need to select the main category that best fits your reported activity. Selection of an Exhibit E sub-strategy is no longer required. Please note, cities and counties will still be required to select a specific California High Impact Abatement Activity, HIAA, for their project or program if you'd like to use this activity to meet the California HIAA requirement. An additional question regarding the most appropriate HIAA will be found in this section. As a reminder, no less than 50% of funds received from the California Abatement Accounts Fund in each calendar year must be used for one or more of the HIAAs. Note that the oldest funds will be used first unless otherwise noted. Section 8 asks cities and counties to acknowledge DHCS's reasonable administrative cost policy for indirect expenses. Total indirect costs for a participating subdivision and its funded subrecipients shall be reasonable and not exceed actual cost or 10% of the total allocation, whichever is less. Indirect costs must also relate to an eligible opioid remediation activity, a qualifying expenditure. Sections 4 through 8 complete the California Abatement Account section. I know that was a lot of information, and I'd like to pause here to see if there was any immediate questions. Please type any questions in the Q&A box on your Zoom control panel. If you have a specific question related to your city or county spending, please send an email to the osf@dhcs.ca.gov email account.
Thank you, Nancy. There are a couple of questions that have come in since the beginning of the presentation, so we can start with those. One person asks about permitted uses of settlement funds, and they note that the settlement agreements and Exhibit E don't speak to this. They're wondering if funds can be used to supplant existing programs or if they must be used for new programs. So I don't know if there is guidance from DHCS that speaks to this, or if there's somewhere in the settlements that we would recommend that person look.
It's actually something that I would prefer to look into and get back to them on. We, of course, would encourage new or expanding programs as opposed to supplanting, but I would have to verify to make sure.
Great, thank you. Another person notes that Cencora and Cardinal Health were included in the distributor settlement. Will the other new settlements that were noted earlier be included into the distributor settlement?
We haven't seen those payments go out yet. Until the time when they've gone out, we wouldn't be able to answer that. We think that they're going to be structured similarly to distributors and Janssen for settlements, but we can't tell exactly how they're going to be paid out yet.
And I believe the website and the AG's office website have the relevant state subdivision agreements for each settlement. And so things like Teva, Allergan have different settlement agreements, which all follow the same structure, but are separate agreements.
Thank you, Chelsea.
Another question asks about the high impact abatement activities that must be spent 50% within an annual year. Is this time period different than the fiscal year for the annual report?
So of all the money received for your California Abatement Accounts Fund, all the money received in the calendar year, 50% of that has to be used towards high impact abatement. It doesn't have to be spent in that calendar year or in that fiscal year. It's just 50% of all your funds received have to go towards high impact abatement activities for abatement account funds.
Another person asks about whether they will be required to report future planned expenditures, or if the report is only covering actual expenditures incurred or encumbered.
Our newly revised report is only covering the current activities as well as those that are being encumbered for future activities. We won't be asking about planned activities though.
Another question is there information on how to go about reallocating funds to the county? I think this person is asking about how to opt out and have funds directly sent to the county instead.
So DHCS does not have any specific requirements for counties and cities that would like to reallocate their funds. You are required to reallocate to another participating subdivision, whether that be another county or another city. And then if you'd like to opt out of receiving funds, you need to contact Brown Greer and the National Administrator for the Bankruptcy in order to opt out and not receive those funds in the future.
Another person asks where they can obtain the list of settlement payments for their city.
The DHCS OSF website has a tab for payment lists where we have uploaded current payment lists. We are pending an update of the distributor and Janssen payment list, as we know another payment has gone out in April that is not on our current list on the website. We will get that posted to our website just as soon as possible so that participating subdivisions can verify the amounts that they've received before they submit their reports. So we hope to have that hopefully by the end of this week, if not the very beginning of next week. There's also information on that payment tab of our website where Brown Greer has now provided a forecast of payments. This is not maintained by DHCS. We just provide information for subdivisions so that they can go there and look at those future payments. Again, this is a forecast, so it's not necessarily an exact amount of what they'll be getting. It's what the anticipation is, though.
A couple of other questions are asking about whether there will be only one or two forms in this year. So the person notes that last year a melon crop bankruptcy was reported separately from Janssen and distributors. And so just confirming that they will be reported together within one report starting this year.
That is correct. We've revised our report to include both settlement and bankruptcies.
Another question about when a city opts out of receiving their funds and those funds are directly sent to the county. If a city opted to have their funding go to the county, do they still need to complete the form?
If a city has opted out and not received any funds from the settlements or bankruptcy, then they would not need to file a report. Those funds now become part of the county allocation, and the city would not be responsible for reporting. If a city has received funds in the past and not reallocated or expended those funds, then they would still continue to do the reporting period until all funds have been either reallocated or expended.
Great, thank you, Nancy. I think in the interest of time, we can move to other sections of the form, but we'll continue to pull through the questions that folks are sending in and address them in our next question section. So we'll keep moving for now, but return to these once we have another break.
Thanks, Chelsea and Nancy. We will now move on to the California Subdivision Fund section of the report. Section 9 will ask your city or county to indicate if it is a plaintiff subdivision. If you have any questions about your city or county status, please check with your counsel representing your city or county on opioid matters. Section 10 will cover payments from settlement dollars that were allocated from the California Subdivision Fund. Note that participating subdivisions may have received 2 payments in the year. Section 11 will cover interest earned on funds from the California Subdivision Fund. Only interest accrued in fiscal year 23-24 should be reported. Please do not include any interest previously reported. Section 12 will ask if any of your California Subdivision Fund allocation was reallocated to another plaintiff subdivision. Again, reallocations do not include funds redistributed to a county by Brown Greer due to a city opting out of direct payments. Section 13 will allow your city or county to report on your expenditures from the state fiscal year 23-24. In addition, Section 13 will ask cities and counties to identify how their activity aligns with an allowable category. Previously, cities and counties were requested to select the Exhibit E category that best aligned with their project or program. This year, cities and counties will not be required to select an Exhibit E category. Instead, cities and counties will be asked to select which category within the definition of opioid remediation most aligns with their activity. The definition for opioid remediation can be found in the National Settlement Agreements. Section 14 discusses reimbursements for past opioid-related expenses. After indicating current opioid-related activities, cities and counties will be asked about any reimbursements or crediting they provided for past opioid-related activities. Pursuant to the relative California state subdivision agreements, funds from the California Subdivision Fund may be used to pursue future opioid remediation activities and reimburse past opioid-related expenditures, which include legal expenses. These past opioid remediation expenses must be reported to DHCS and Brown Greer, depending on what the funds were used for. Cities and counties are required to report any funds used to credit past legal expenses to Brown Greer. Please note that Brown Greer refers to these expenses as non-opioid remediation uses. Cities and counties are required to report past opioid remediation activities to DHCS. To capture these expenditures, Section 14 covers past opioid-related expenses, which include litigation fees and/or previous opioid response efforts. In this area, your city or county will find questions related to what type of past opioid-related expense you had, opioid remediation efforts, or litigation fees. Cities and counties will be asked how many past opioid-related activities they credited, as well as how much funds from the various settlements were used toward these credits. It will also ask if you had reported past litigation fees to Brown Greer. We will pause again for any questions related to the California Subdivision Fund section. Please type your questions in the Q&A box on your Zoom control panel.
This question does not pertain to the California Subdivision Fund, but it was asked in the prior section, so I'll address it here. A couple of folks have asked about expenditure periods and how long counties or cities have to spend the funds that they receive. So Heather, I wonder if maybe you could speak to that from the perspective of the Abatement Accounts Fund and from the Subdivision Fund.
Yeah, no problem. So the Abatement Accounts Fund, as we previously discussed, has an expenditure period of 5 years or 7 years if it's a capital outlay project. The California subdivision funds do not have those same expenditure reporting or expenditure requirements for a time frame. We do recommend that you follow the similar structure for the abatement accounts, but again, there is nothing in the requirements for that.
Another question that was previously asked is about the resources that were mentioned earlier to help folks with completing the form. They ask when the new reporting PDF will be posted, and I believe, Heather, that should be posted either later today or early tomorrow, correct?
Yes, that's correct. Thank you.
Another person has asked about their recent payments received on the DHCS website, and they can determine whether the payment is abatement or subdivision fund. How would someone go about knowing what whether the payments that they've received have come from the abatement accounts fund or the subdivision fund?
That information should be available on those payment spreadsheets that Nancy spoke of that are available on our website. You can also contact Brown Greer or NOAA directly. You can also contact your local city or county council for questions regarding that.
Pertaining to the California Subdivision Fund, someone asks about the 10% holdback or backstop that was released to pay legal counsel and whether that is something that is included in this reporting form.
We do not collect information about the backstop. It'll only be the exact payments that you received that will be recorded on that payment spreadsheet that we have available on our website.
Another person asks about the opioid remediation categories for the subdivision fund. And now that it's gone from Exhibit E to only 3 opioid remediation options, they're wondering if they're going to be asked any more nested questions under those 3 categories.
No, there will not be any further questions other than we will still ask like a general program description and a program name. But other than that, it's just those 3 questions.
Another person asks, when reporting interest, expense, and payments received, will we continue to report it by abatement account and subdivision fund?
Yes, all funds received, including interest earned, need to be separated and delineated by fund type.
And then just another clarification on timeframes. This person is asking to confirm for the subdivision fund that there is no time frame, although DHCS, as you mentioned, does encourage folks to spend those within a timely manner.
Yes, that is correct.
I think those are our questions for now. Like I said, as they continue to come in, we'll pull them in and address them in our next break in the presentation. But for now, I think we can continue on with the next section.
Okay, thank you, Chelsea. We'll now be covering the Medi-Cal bankruptcy funds. Section 15 will cover bankruptcy funds received from NOAT 2 and any interest earned. Again, only interest accrued in the fiscal year 23-24 should be reported. Please do not include any interest previously reported. Section 16 will cover any funds that were received from NOAT 2 and then reallocated to a different local government. Reallocations do not include funds that were redistributed to a county by NOAT 2 due to a city opting out of direct payment. Section 17 will ask local governments to report their related direct and indirect expenditures. As you will see, this section was updated to request expenditures broken down by 2 time periods, July through December and January to June. This update was included in the expenditure reporting form due to requirements with NOAT 2 reporting. Each year, DHCS will compile a report to NOAT 2 on behalf of all cities and counties regarding how funds were expended. NOAT 2 requires this information be reported by calendar year instead of fiscal year. Thus, this section was adjusted so that DHCS can report on expenditures by both calendar and fiscal year as required. Please note, local governments do not need to submit a report to NOAT 2. DHCS does this on behalf of all local governments. Section 18 will cover the amount of bankruptcy funds spent on administrative expenses. These are the indirect costs. Notes, cities and counties may spend no more than 5% of the bankruptcy fund on indirect costs per the requirements of the California Mallinckrodt statewide abatement agreement. This differs from the indirect cost percentage for settlements. The acknowledgement of administrative expenses, indirect costs, marks the end of the Mallinckrodt bankruptcy section. Finally, Section 19 of the form will ask to confirm the preparer of the report is authorized to sign and submit on behalf of the city or county. It will also confirm that information submitted was true and correct. And we'll pause again to look at the questions.
Great. We'll pull through a couple more of the questions that were previously asked. So for the California Subdivision Fund, legal counsel fees are under what category in the reporting form? Is it considered an admin cost, or would it go under the legal expenses questions in under the subdivision fund?
The subdivision fund can be used to pay for past opioid litigation, legal expenses. Any further questions in regards to that should be directed to your county counsel.
Another question, are there requirements or regulations on how funds are distributed to implement activities? Is there any guidance in terms of how cities and counties must distribute these funds? I assume, referring folks back to DHCS guidance, but anything else you would offer there, Nancy?
Yeah, DHCS does not have any specific requirements or guidance in this area. You would follow probably your city or county's typical standard procedures for subcontracting. We just have to make sure that the city and county doing the reporting gathers all the information from any of its subrecipients so that they can be reporting accurately to DHCS.
Another question pertaining more so to allowable costs. Someone wonders if funds can be used for personnel costs for a behavioral health professional to do street outreach with law enforcement for unhoused populations. So I think just speaking a little bit to what is considered a high impact abatement activity and what sorts of activities are considered allowable. And I know, Nancy, you mentioned a few website resources as well earlier that can be helpful in kind of determining those priorities and uses of funds.
Yeah, personnel expenses related directly to the activity or program that is a qualifying expenditure can be part of the direct expense of that activity or program. So those should be included with your direct costs.
Another person asks about the distinction for indirect costs between the bankruptcy and the settlements. They want to confirm that indirect costs for Mallinckrodt is capped at 5%, and for the settlements, it is capped at 10%, correct?
That is correct.
Another question is about using OSF for Medi-Cal match and squaring that up with Medi-Cal revenue. Basically, this person's asking if there's an opportunity to revise reported expenditures at a later date as they bring those two things into alignment. So I don't know, Nancy or the UCLA team, what guidance you have about completing the form or going back for corrections at a later date.
I can answer that. So you can be in the form and leave the form, and when you go back, it all should be filled in, but we do suggest getting it done in one go, just in case if there's any technical issues or some sort of mishap does happen that it's not saved. So we suggest filling out the PDF first, or just gathering all the information before you start the form and finishing it in one sitting. But it should work if you leave and go to the same browser.
Diane, you're on mute.
Oh, was I muted that whole time? Or did it?
Just the last little bit.
Okay, so it should work that if you do leave the browser and go back to the same browser later, that where you were to that point should be filled in. But like I said, we suggest filling it out all in one go, just to, save any mishaps from happening. That answered the question.
Yes, I think so. And while we have you, Diane, another person asks about tech support in the filing of the report. If people have questions as they're filling it out from a technical standpoint, rather than spending requirements and reporting, how should they best get in contact with the UCLA team?
Yeah, so my email and my team's email should be available. I don't know if it'll be in these slides or not, but you can always email my team and me directly if you have questions about the form itself. If there's any technical issues going on with the form, we can help you troubleshoot them. Or if you need to submit revisions, we'll be the one sending you a link that will bring you back to your filled out form that you can revise, so you don't have to refill out the entire form. So any technical questions can be sent directly to me and my team.
Great, thank you, Diane. I'm going to return to some questions about the requirements for spending. Another person asks about whether the 10% indirect cost limit applies on a fiscal basis or for the entire settlement. So I think they're asking about this requirement and how it's applied, whether across the entire payment period of the settlement or on an annual basis.
I'm not quite sure I understand the full question. Can you say it one more time, Chelsea?
The person asks if the 10% indirect cost limit applies on a fiscal basis for the entire settlement across the 18 years, or I think that they're asking whether it will be asked in each fiscal year reporting. I think the way that it's captured in the form is by each fiscal year that there's a cap of 10%.
Yeah, when we look at each reported remediation activity, it shouldn't exceed 10% for abatement account funds at no time, and then you'll never exceed the 10% of your total allotment.
I also want to add that the 10% is also specific to the fund type, Jansen or distributors.
And Chelsea, I got a little more clarification on that supplanting question that I'd like to provide. So the state subdivision agreements, nor does DHCS have a policy that restricts supplantation. However, any supplanting of funds would be restricted to eligible opioid remediation activities that are identified in Exhibit E. Thank you.
Great, thank you. And I also just wanted to flag related to the technical support for the survey through UCLA. When you go into either the PDF of the form or at the top of the actual form in the online version, you will see contact information for UCLA should you have any questions. So that will be available when you go into the portal. You'll see who the correct person is to contact there with any technical questions. So we have a few minutes left. I think we are at the end of questions in terms of new topics. We'll give folks just one more minute to submit anything else in the chat that they may be wondering about. All right, well, not seeing any more come through. Again, if you do have specific questions, you can always send an email to osf@dhcs.ca.gov, and Nancy and Heather and their team of analysts will be happy to help you with any questions that you have. Next slide, please. So next steps, as mentioned earlier, the online reporting form will be sent to all participating city and county contacts on Monday, July 1st. Please reach out to DHCS at that email address if you do not receive the link, or if you need to update your contact information with DHCS, please do so. As mentioned earlier, only one report should be submitted for each city and county. Please make sure that there is one person on your team that's designated to do that so that there aren't conflicting reports that are submitted. The reporting form will open on July 1st and close on September 30th. As mentioned earlier, there won't be extensions for this time period, so that 3-month period will be the time frame in which you have to complete the report. Next slide, please. DHCS will be sharing a survey in the coming weeks to solicit your thoughts on TA topics that you'd like to see covered in future webinars, trying to make sure that the resource materials posted to the website and the topics that are covered in these webinar informational sessions are useful to you and provided in a format that is most helpful. That survey will be shared on July 15th and request that you complete that by July 31st. So please do complete it, as it helps to ensure that the DHCS team is providing technical assistance in the most helpful manner for cities and counties. Next slide, please. And finally, all information that's covered in this webinar today, as well as the guidance and resources that were referenced throughout the presentation, all will be available on the DHCS OSF webpage. Questions can always be submitted to the inbox or use the technical assistance form located on the DHCS webpage. So with that, we'll wrap up the presentation, but thank you all for attending today, and look forward to hearing from you.